Now I thought to tell you about the leg, the calves on the back of your leg, or your shin muscles on the outside front of your leg. Shin splints is when the muscle is so tight and the membrane around it is so tight that it gets infected, that it gets irritated too much. Not infected, but inflamed. To make it smoother, to make it able to relax. If it is really hard, and almost like the bone on the other side, but very tense and hard while you're relaxing, then it's most likely tensing for fixing something or being irritated. It easily gets irritated, the muscle, because when the bone on the outside, your fibula, which is from here to just underneath your knee, I can show you that better this way, just underneath your knee is a little bony part where the top of your fibula connects to your tibia, the rest of your lower leg. And if this one is not moving so well, which it should do, forward, slightly outward, and backward, slightly inward. If it doesn't move so well, then it easily gives more tension to the whole muscle here and the other muscles around. If you then massage a little bit in front of it, maybe above it, a little bit behind it, which is always a little bit sensitive, but make it a little bit smoother. If you manage to push it a bit back and forwards in that slightly outward, forward and inward, backwards movement, if you manage to get more mobility there, and the same actually at the bottom, but you take both those bigger bones of your ankle and you move them a bit back and forwards. If you manage to get more movement, maybe some massage in front and in the back, then this easier relaxes. That's what I do in the treatment. If it helps a little but not long enough, you can do some like this at home. If you might need treatment but you can fix it already on your own, that is really cool. See if it then is easier to relax, to massage, rather not too much massage down but rather up for your blood circulation, which is important from your hips down, from your groin down, that you massage towards your heart, or sideways or diagonally, but rather up than down. And see if you can stretch it more, if you can relax it more, and if it is less tight and less irritated. If also the irritated shin splints, if you have that, if it's less tight and easier to stretch, but if it's so irritated, you need to be quite careful not to irritate it too much. What else you can do is more working on the ankle and the calves. The calves attach to the thigh bone, to your femur, and therefore it's important that not only you can stretch and bend, but also that you have a slight rotation in your knee. When your knee is straight, your hip starts to move, and your knee is quite straight, stiff. But if you have your knee bent 90 degrees or less, then you can actually move and rotate. There it's quite important that if you look from the top on your knee, that if you have your fingers on both the outside and the inside of your tibia, the shin bone, if you then turn, this one should go forward and this one should go backwards. And if you go the other way, that they should turn both the other way, and not just that this one is standing still and this one is doing all the work, or the other way around, that this one comes forward but doesn't come back or so. If it doesn't come enough forward, you can try to massage backwards to make more space around your knee, just underneath your knee, where there's a little gap from the top of your tibia and the bottom of your femur. You can massage just in both directions actually, nicely into the sides, maybe a little bit behind your knee, especially when it's relaxed. Now I'm holding it up so it's a bit tensed. And then see if you can rotate it a bit more, if you can help it further forward, if it didn't want to go forward, help it more backwards, if it didn't want to go backwards, on the outside or on the inside. Then there's more mobility of your knee in rotation, and the top of your calf muscles and the bottom of your hamstrings will easier relax. Also some from the inside, from the adductor muscles. The same is then important for the bottom of your calf muscles, your Achilles tendon also connected to it, that your ankle and your heel is moving well. So if you have a problem with your heel in general, that it's stiff, you can mobilize it in many directions. You can try to rotate it a little. It feels quite stiff, but it has a slight little possibility to move. should have. So work until it does. Or find an osteopath to help you. But else you can try to move your leg, ankle, slightly above your foot, back and forwards. Sometimes it's easy to just leave your foot on the table, chair, sofa where you're sitting, and try to push it back, pull it back while your heel is still stuck, or you leave it there and try to push it forward, or maybe easier to hold your whole foot and your ankle and try to move them opposite of each other, that you try to push it this way and put it that way. Not so much the up and down, but you can combine it. When your foot goes down, your toes go down, you should actually have the top going forward, and this way also, that it goes backwards. So you can drag your heel down, not sliding, but that's showing the movement, and then this down and your toes up to make that sliding movement into your ankle optimized, better. If that sometimes it's also not only your heel but also your ankle that is a bit stiff in that position of a inversion trauma where you have sort of twisted your ankle. So then you can not only twist your foot and your heel opposite of each other, but you can actually try to twist your whole heel and foot together back again to a normal position. If it hurts too much, don't do it. If it's a little bit stiff, try to see if you notice that it moves better. Especially if you have one foot that is painful, one foot that is stiff, you can always compare to the other side and see, is that then actually easier? Then the other one should be as easy. Try that. And then if it is a bit more smooth, then also your calves you can massage, you can squeeze, you can twist a little bit from side to side and see if it gets better. See how this feels.